Hey y'all. Happy Tuesday. I am back with another article. This article today is from US News. Your toothbrush could be a lifesaver in the hospital. And I thought that this article was interesting for several reasons. The first reason is that we've actually known this for a really long time, so it's not even new news or a groundbreaking study. So I thought that was kind of interesting. Actually, the first time that I learned how helpful and essential oral care is was when I worked in the hospital as a nurse assistant 12 years ago, 13 years ago. I was probably about 25. So this is not new knowledge, and why the doctors at Brigham and Women's in Boston had to do a research study to tell us this, I'm not sure. I guess maybe it just was looking at the ICU data, but it's definitely not new knowledge. We've been knowing this for quite some time, and of course it makes intuitive sense. The second reason I thought it was interesting is because of the very obvious reason that we all knew the entire time that masking throughout the pandemic would increase the risk of pneumonia, because you're literally creating a warm, dark space for bacteria to grow inside your nasal passage and your oral pharynx and your mouth, and that would increase the likelihood that people would come down with a bacterial pneumonia either after they had COVID or just like on its own. So I think it's interesting how they can admit how important oral care is, and decreasing the amount of bacteria in the mouth is, except for in settings when they conveniently don't want it to be true. So this study, like I said, this was from doctors at Brigham and Women's. They looked at 15 clinical studies and 2,700 patients, and what they found was, pretty obvious, like I said, that daily toothbrushing is a, quote, lifesaver in the ICU. It translates to shorter stays and shorter time on the vent. And they published this article in JAMA Internal Medicine. JAMA Internal Medicine. What is the word I'm looking for? Publication. All right. So the reason why is because people, especially when they're really sick and they're on mechanical ventilation or in the ICU having any type of trouble swallowing correctly, is the risk for aspiration pneumonia, or like I said, if someone is on mechanical ventilation, then just for secretions to basically follow that tube down and end up going to the lungs. So in that case, a person who had other lung issues, other reasons for being in the hospital or on mechanical ventilation, could end up with a bacterial pneumonia on top of everything. They usually call that a nosocomial infection, and the hospitals try to avoid this at all costs because it's basically on them, and they don't get the same kind of reimbursement when they cause a nosocomial infection. And also, of course, it translates to longer stays and increased mortality for patients. So the reason why this is important is obviously good oral health, good oral care. Just brushing the teeth every single day is going to reduce the amount of bacteria in the mouth, and that's going to reduce the likelihood that those bacteria will then be aspirated or travel down into the lungs and cause infection. So Dr. Michael Klompas from Brigham and Women's, who did this study, he says that this was basically a mortality shrinking intervention, and that it's super rare that they're ever going to have something that's so cheap and easy to implement that's going to have such an impact on mortality without being like, a drug or a costly intervention. And I just wanted to highlight that this is exactly the type of thing that Samantha and I talk about for everybody in our daily lives. The best treatment is prevention. The cheapest, easiest things that you can do for your health are literally the most important. So along with the increased risk of pneumonia if you don't have a good oral care. So this translates to at home also, or like I said, people who are masking, things like that. But even if you're at home and say you just get a little virus or your kids get a little virus, it's extremely important that you stay on your good oral care regimen, because otherwise you're going to increase bacteria in the mouth and you're going to set them or yourself up for a chance to end up with a bacterial pneumonia following that viral infection. So it's very, very important to stay on that oral care regimen. Today, for example, actually before I even read this article, the reason that I chose this article to go through today was because my son, he had a little bit of runny nose starting this morning, kind of a little bit of a like, but not really that sick. So I had him brush his teeth, and then I felt like he didn't brush them good enough. And so what I did was I had him brush them a second time, making sure he was getting all the surfaces and everything, because I know that if he doesn't have good oral care, then he's more likely to get a worse infection, continue to have like an increase in infection, or end up with like a bacterial issue. Another thing that I will do today is go out and purchase some new toothbrushes. In our home, we typically replace toothbrushes at least every single month. I try to replace them as often as possible if they start to look bad or anything, or if he has like a little illness or I have a little illness. That's always an important time to replace your toothbrush, because otherwise, even if you're on antibiotics or something, if you get, say, a strep infection, it's still on that toothbrush, it's still on that toothpaste. It's just good practice to throw it out and get you a new one. Another issue that a lot of children have, that thankfully is not the case for myself or my son, is that they have had a tonsillectomy. This can be true for our parents. This was very popular when I was younger, and it can be true for children now, because tonsillectomies are pushed for a lot of different reasons. Recurrent tonsillitis, like more than a certain number of infections within one year or several months, infections or inflamed tonsils that don't go away, enlarged tonsils that can cause, difficulty breathing, and other issues there. So again, if a person was suffering from recurrent tonsillitis or had a tonsil infection that was not going away, I would recommend to them to, at the very least, think about changing their toothbrush out extremely often, especially every time that they go through a course of antibiotics. But you could even try to just trade it out every week and not share even toothpaste, because everybody knows when you got toothpaste, you're going to be using your toothbrush on it, putting it in your mouth, and then later you're going to be using your toothbrush on it, putting it in your mouth. So if multiple siblings are doing that, you can easily be just passing a strep infection back and forth. So you don't want to do that. Tonsils are important because they are our first line of defense against bacteria and viruses in the throat. And we also have another structure called the adenoids that is our first line of defense also in the back of the nose and mouth, like the nasopharynx area. And those also do the same action of preventing infection. So one of the issues is that they usually want to take out tonsils and they want to take out adenoids at the same time whenever there's these recurrent infections. And that can leave a person very vulnerable to increased pneumonia. So I read an important study, tonsillectomy. They looked at tonsillectomies for children that were between 3 and 10 years old that had their tonsils removed, and compared that to children that had not. And they looked at this over the course of 8 years, and they did find a large increase in the incidence of these children who had their tonsils, and I'm assuming their adenoids also. They had a huge increase in risk of pneumonia over children who had not had their tonsils and adenoids removed. So they're not just a benign throwaway structure. They serve an important purpose, and trying to preserve them is super important. So if somebody does have issues with their tonsils, tonsillitis, infection in the tonsils, enlarged tonsils, anything like that, things to try that are not going to be like medical, these would be, they call them CAMs. I think it's like complementary adjunct addition to medicine or something like that. This would be like a complementary treatment. Gargling with salt water or baking soda, both of those are going to help to clean the area, and then you just spit it out afterwards. They're going to help to clean the area, kind of change the pH in the mouth, and soothe the tissue. Humidifiers, if you're having like active tonsillitis or active kind of infection, can be really helpful. And also just the knowledge that tonsils shrink over time. So I have looked in my son's throat before and seen that his tonsils looked pretty enlarged. As he gets a little bit older, his tonsils will continue to shrink. Now, it is important to note that the tonsils are most important before puberty. From the reading that I've done, after puberty, apparently they aren't as important for this control of infection, but they are still a part of your body, and I believe they're important structure if you can't preserve them. Another study that I looked at talked about vitamin D deficiency being associated with, I believe, increased tonsil size and just recurrent tonsillitis. So looking at vitamin D supplementation and getting enough sunshine, super important there, and can be very helpful for not just the tonsils health, but for the immune system. Vitamin C was another one that I looked into, and that showed a little bit of kind of like controversial takes, but I did see that it's possible that vitamin C can help with tonsil stones. If you ever have tonsil stones, there's different ways to get rid of them, sometimes just the gargling and stuff. I usually don't get tonsil stones, but I check for them with like a Q-tip anyways, because you can usually kind of just push them out, clean the tonsils, and move on. But again, replacing the toothbrush. So we want to have good oral health, replacing the toothbrush, vitamin C, vitamin D, gargles with salt water. All of those things can help us to not have to either get our tonsils removed, which are an important line of defense, or even if we have, then they can also still protect us from this risk of pneumonia, bacterial pneumonia. So like I said, we always want to have good oral care, especially when we're sick. And another big part of this is actually going to also be nutrition. So when you are sick, you definitely want to avoid sugar at all costs. Yesterday, I did the bad thing. I was a bad mama, and I bought my son a cookie. It was like a full sugar regular cookie, and gave it to him. And then of course this morning he was feeling a little, under the weather with like a little bit of a cough and stuff. And I should have known better in the height of cold and flu season. I know you guys can battle me on that, whether or not colds, flus, or it's just detox season. I shouldn't have given him a sugary snack, knowing that it will have an impact on his immune system and also the bacteria in his mouth. So avoiding, sugary snacks, because going back to the 1970s, it's been shown that basically 75 grams of sugar, which is like 2 8-ounce sodas, like 2 small sodas, is going to have a significant impact in reducing the immune system. So that cookie probably had, he didn't eat the whole thing, luckily, but it might have had 50 or 75 or even 100 grams of sugar. I'm not sure. So it could have had a slight impact on his immune system since he didn't eat the whole thing. Same thing with sugary drinks, sugary beverages. Those are even worse because they're going to coat the entire mouth, coat all the teeth, change the pH in the mouth, and increase, those bacterial overgrowth there. So we want to avoid that because of 2 reasons, like I said: impact on bacterial growth in the mouth and impact on the immune system. And that's about all I have to say about that topic. I am going to upload this video to YouTube. Thank you all so much who tuned in.